Assalamu alaikum, the communication day. First scenario, Mrs. Muna, 38 years old, presented with deja vu symptoms for 2 months with repeated fits. Her GP referred her to the hospital. CT brain showed brain tumor. Your consultant asked you to talk to her regards result of CT and need for further MRI brain and to put further management plan. Ready, Dr. Mayeda?
Yes, ready. We can start. Hello, my name is Dr. Maida, one of the medical doctors in the unit. Can I confirm that you are Miss Muna, 38 years old?
Yes, I am.
Hi, Miss Muna. First, before we start, we are here to discuss if CT scan has the result of the CT scan. Do you want anyone to be with you?
No, thank you, doctor.
Okay. So before we start, can you tell me what was your symptoms?
Along the last 2 months, I'm feeling I'm not good, and I have some symptoms that when I meet any person, I shake hand with him, and he said, "Do you know me?" like this, and some changes in my behavior as well. And the last 2 days, I have fits and I lose my conscious level. And the GB referred me to the hospital. And yesterday I did CT for my brain, and I came today to know the result for this imaging.
Before we tell the result, do you have any idea what it may be?
I expected it is simple issue because I did not sleep well and I have stress in the last 2 months.
Do you have any specific concern about the result?
I am much concerned because this is my health. Everyone in my position, he will be much concerned. Why
I mean, you have any concern about what it may be, the result?
Expectation, as I told you, my expectation, it is simple issue because I have stress in the last 2 months and I did not sleep well. And my also diet is not good. I feel suppression of my appetite last month.
I'm so sorry for that. Miss Mona, the results is with me now, and I afraid it's not as we hope. The CT brain show that there is a tumor in the brain.
Oh my God. Cancer?
I'm so sorry to tell you that. At the moment,
Like my grandfather also had cancer, but he was old man. I am only 38. I did not yet enjoy my life. Are you sure, doctor, this is cancer?
I'm so sorry to have this news for you. At the moment, we know that there is a tumor. There is a growth in your brain, but we are not quite sure about the nature of this tumor at the moment. That's why we may need to have another scan, which is called MRI. Do you ever heard about this MRI?
Yes, I hear about it in newspaper, but I don't know what it is.
Okay, it's
different from the CT. There is any difference between both imaging?
Yes. So it's a more detailed image that we can show exactly the how the nature of this tumor, how it looks like, and it can give us more details than the CT scan. So we need to make sure that is it like a cancer type of tumor or it's a benign one. in order to know exactly the site and location and the size of that tumor, we need to do this MRI, the image, what it's called the MRI. Do you want me to tell you more about it?
I have much concern, doctor, because recently I think my brain is not good because of these fits and this shaking of the body and the shortage of oxygen supply to the brain. So it will receive two imaging with two radiations in 1 week for the brain. It may be harmful to my brain.
Mm-hmm. I highly appreciate that. However, it's working differently. The MRI is working differently from the CT scan. We use radiation in the CT scan. However, in the MRI, we are using magnetic resonance. So it's totally different. And but it can be more detail about your brain tumor. How this
So it has no side effect. So it is not. It doesn't have any side effect on the brain tissue.
uh, yeah, the side, we can say it have side effects, but not that a lot like the radiation.
What is this side effect, doctor?
Okay. The common side effect, it can be from mild to even it can go to severe one. So this one of the side effects, it can be reaction to the substance we use to the contrast. So it can cause like nausea. It can even cause some headaches, and it can cause some metallic taste. Uh, and rarely, very rarely, some people have a reaction to that contrast with rashes and itching. And in a very rare condition, it can take like a severe reaction. Uh, Also, it can cause some, if these reactions happen, it can affect the kidney as well. Are you following me?
Yes, doctor. Okay, doctor. Okay.
Okay. The only thing that's about the machine itself, it's have a noisy, very noisy machine. So the MRI machine is loud, and sometimes we use earplugs or headphones to can be provided by that so to decrease the noise of this machine. Uh, the also it can cause some discomfort in some people. The only thing that I want to ask you, do you have any pacemaker or any procedure have been done to you before?
Yes, doctor. 6 months back, I have pacemaker,
Mm-hmm.
and should be today at 11 a.m. I have appointment with the EBS doctor
Mm-hmm.
in the heart center.
Okay, okay. Um, yeah, I think the pacemaker and this implanting thing, sometimes it's can cause discomfort and heating, and sometimes it's we are not normally provide the MRI with that, but
2 minutes left.
okay. Just one more question. Are you pregnant?
No.
Okay. Okay. What do you do for a living?
I am a taxi driver.
Okay. So what's your concern?
I have much concern about my management now. What you will do for me?
Okay, so what we're gonna do, after we have the MRI, we can refer you to a multidisciplinary team. This team including the brain doctors and the brain surgery, and we can also involve the cancer doctor if we have this aware about cancer and a specialist nurse. So all this team will gonna go do together and psychologists to help you to go through this hard time because it's we know that it's not an easy period of time. So all this team will work together to make sure that you are having the good management plan and you go through this hard period supported. How that sounds?
Yes, okay, doctor. Thank you. Thank you,
And
doctor.
And also we can involve the occupational therapist to help the occupational team and physiotherapists and speech therapists and all those people can be involved in your management plan and to have the correct management plan for you. Is that okay?
Okay, doctor. Okay.
Okay.
Thank you.
Any more concern for Intaha?
What about my birth control pills, doctor? I will continue use it.
I'm not quite sure at the moment about it, but we need to involve the woman doctor in that. She can give us advice regarding the birth control. But generally, because it can affect the we don't know what it is, what is the cancer, what is the tumor is. We think that it's better to stop it, but we will discuss this with the woman doctor to give us a correct way to help you to control birth, because I think pregnancy at the moment is not one of the best of interest of you, isn't it?
Okay, time's
So
up.
I will go home. So I will go home now, doctor.
Okay, last concern.
At the moment, yeah, because you have these fits, and do you have fits now?
Yes, at 6 a.m. today, I
Okay,
supposed
so we'll
to
keep you in the
treatment.
hospital at the moment because it's still you have symptoms. I will keep you in the hospital, and we have this MDT. Uh, because you can't go home as you have this active fits. If that sound okay?
Okay, doctor. Okay,
Okay,
doctor.
yeah, I think time is up now. Any concern, Dr. Mahi, you want to add?
Yeah, thank you,
Okay,
doctor.
you can comment now.
Well done, Dr. Mayada. Very good, wallahi. That this is a tumor and we don't know it is cancer or no. So when I break the bad news, it is not cancer. Not sure yet what this type of this growth, it is cancer or no. And the MRI will give us more details if it is cancer or not. So this is يعني the best answer for this in this scenario. For also you asked me about pregnancy, and this is hidden agenda. Yes, I'm not pregnant, but also written in the scenario that you should put a management plan. So we should start for her now anti-epilepsy medication to subside these recurrent fits. This is at least yani, before discharging the patient. And I'm happy that also from hidden agenda, this MRI. So you asked about pacemaker or any metallic devices or metallic teeth in the mouth as a contraindication for this. But I don't know how you address this concern that patient has pacemaker. You told him you cancel the MRI or what you? I forgot what you told him.
Uh, Generally, it's contraindicated, but we need to discuss this with the radiologist.
With the EBS or cardiologist.
Radiologist, and because they will not take the pacemaker out, yeah. We need to discuss with the radiologist if there is anything we can do.
Because recently the pacemaker ICD, CRTD, these devices recently they manufacture it by a way that not contraindicated with MRI. So we will refer the patient to the EBS doctor, cardiologist, and by his device, he can match the machine, the device with the machine to know if it is contraindicated or can proceed forward. Okay.
Mhm. Okay.
So
It is the
even
recent
the
machines it compatible. So the problem not in the pacemaker itself. The pacemaker, even if it's old, and this new machine of MRI, the new machine is compatible with any type, even the old one.
yes, Dr. Aisha. Yes. Yes, this is the only thing is in this scenario. Hidden agenda about stop driving and involve the occupational health worker for allocating him or her to another job, and also for pregnancy and oral contraceptive pills, not because the cancer or the tumor, but because we will start here for anti-epileptic medications, which has drug-drug interaction. These anti-epileptic medications decrease the efficacy of oral contraceptive pills, so patient can possibly get pregnant without any warning. And also for pregnancy, any chance of pregnancy. So this time is not a proper time for pregnancy. So pregnancy should be planned in the future, not now. Okay. And to start for the patient anti-epileptic medication at moment until we fix this tumor, if it is malignancy for resection or management. This is only the issues in the scenario. I finish now.
Yeah, thank you, Dr. Mahi. Very nice scenario. As uncertainty, still the diagnosis is not yet confirmed, but there is a mass or there is a lesion, whatever the name, but tumor is a jargon. So I prefer to say there is a lesion or shadow. The best word here is the shadow. There is a different shadow in the brain, different than the normal areas or normal tissues, which is
Yes,
quite
tumor is written in the paragraph of
jargon.
from doctor to doctor, GB to the
Yeah,
hospital.
but you cannot tell to the
When
patient.
yes, but when I talk to the patient, I will say what I will say. Shadow?
I prefer the shadow. Yes, there is a shadow in the CT
Actually,
or
you
the
can
MRI.
say tumor. Tumor is not jargon. Tumor is not a jargon. It's you can say tumor to the patient. They know the tumor. I don't know.
No,
No,
I think they are most familiar with the cancer, not tumor. Tumor is, for me, I remember it's a jargon. Maybe in UK they are using it. I'm not sure, but the best I prefer to say shadow or lesion in the brain, which is not confirmed yet to be a cancer. Maybe good growth, maybe cancer, which is bad growth or nested growth. So we have to do MRI to confirm our diagnosis. Possibly, this patient had seizure. It might be cancerous because it's growing, exceeding the size or larger than the size. However, we still don't have the confirmatory test for the cancer. So we are going to do the MRI. I like when you invite someone to attend because it's somehow difficult to absorb this information by the patient. She's still young. She might need support, as you know, and as she said, she had history of family history of cancer. So it might be hard for her to listen about this bad news, and it might be cancerous lesion, as the father or the grandfather had this cancer before. Okay, the hidden agenda, it's perfect to specify them. Dr. Mashallah, Dr. Mayada, remember all of them. Pacemaker, I don't know how you remember it, which is very difficult to remember either in the exam or even in the scenario. But maybe because you are familiar with the MRI, always they are asking about devices. And as Dr. Aisha mentioned, is it compatible with the machine? The best answer again is either the cardiologist or the heart doctor or the programmer. There is programmer for each device. He can come to assess, and it might be off during the procedure. Better than leaving it working, and it might be destroyed if by the magnetic field. So the best answer is to check it with the heart doctor or the programmer who is responsible for the technical issue regarding.
They can't make it off, Dr. Ben. How you
Yeah,
will make it off?
they can put other continuous, for example, sorry, continuous. Press.
Even it will be metal. Now there is programmer special for anything. If you have any metals in your body,
Yes,
there is
I
some
agree.
modalities now in MRI. They will adjust something in it, and so all the recent MRI machines have this modality.
I
So now
agree.
we not advise about this point, or you will not mention it at all, because
Okay,
now it is out for maybe 10 years ago out. Don't mention this point. Maybe if she asked, okay, you can answer, but don't, I think no need to mention it.
Actually, it's still there is they use machine that we still asking this patient the patient.
so
This
the best way is to refer. I believe it's the best way to refer, not to stop
They
or
ask me
not.
the patient, Dr. Mayeda, because there is some
we ask the
option
patient.
you will use. Yes, in MRI. There
We
is
ask the
machine,
patient.
something they will make like synchronization, something in the machine they will adjust
Dr.
if you have
Aisha, we
metal.
cannot assume that it will be compatible and the machine is compatible and it's precious device.
But
Maybe
don't
they will
said
refer
stop
the patient.
the machine. Maybe yes,
Okay,
you will
I'm
said I'll
yeah.
okay.
I will not
I'll
stop by myself. I will say
mm-mm.
the heart doctor will come to assist if need to be attached or to be, for example, because the electricity will be
They have some
disturbed by the
solution. We
magnet.
can yes, we
Okay,
can set that
this is
yes.
not our job or this
Mm-mm.
not our
They have solutions for these things, so
okay.
they will advise you about yes.
Okay, I agree for that. But I mentioned to stop as the solution, but it's not our job. You're right. But if you left it working during the magnetic field procedure, I guess the electricity will be distracted or disturbed by this magnetic field. So I'm not sure what protocol they are following. As Dr. Maeda said, there is possibility to be old, there is possibility to be new, there is possibility to the MRI to be all not compatible with the device. So let it
Yes,
for the
maybe yes, yes.
yeah. Okay. But at least you have to ask this question, particularly with the MRI.
You have in scenario?
In any scenario, patient going to MRI, any
I
scenario.
don't know.
No, it's a must.
Generally,
Yes, for the
in the
communication
real
or
life,
for the real life
in the real life, we
Both,
are
communication?
asked.
both, even
Both.
in the real life. I
Maybe
will tell
yes.
you a story, real
Mm-mm.
story. One patient, it's in our hospital. One patient went inside the MRI room. By the way, it's a room, not even the room. While you just cross the line of the door, you will feel something attracting you. Any metal in your pocket or even in. I will tell you what happened exactly. So it was, or he was elderly patient, male, and he was using stick. There is metal part in the stick. Imagine the stick flies to the face of the technician and it hurt the technician in her face.
Mm.
Imagine how much the strong waves
Yes, yes.
and
You are right.
magnetic
Yes.
field it
Mm-mm.
flies. Imagine anything inside the body.
Yes,
The
it is
patient maybe
like the CT
yes,
with contrast. And there is already consent for MRI, so they will sign this.
exactly.
Yes, I forget this consent, Dr. Aisha.
Yes, he
So,
should sign consent in MRI and
but
CT contrast. He should
written
sign
consent.
Yes,
consent.
there is
Written
consent.
Mm-mm,
Yes.
written.
consent.
Yes,
Yes.
perfect. So that's why we are discussing the scenario together. Everyone will give a clue or something to be missed by the candidate and to be revised, and we will discover it. So Dr. Aisha, remember now, or Dr. Dr. Aisha mentioned the consent, which is very important. But I will
Yes,
ask,
written
is
consent.
it with contrast, Dr. Muhi? Some MRIs need to be with contrast and others without contrast. I don't know
Without
for the
contrast.
cancer.
Sorry, MRI need consent,
Yes,
Yes.
written consent.
written consent.
Mhm.
Yes, CT with
Th-
contrast and MRI also need written consent.
there is what's called a checklist. It's a paper should
Yes,
be filled
operation and the
in
procedure
a
and this
surgery.
and the
Yes,
contrast and the blood transfusion. All these consents.
Blood transfusion, yes, consent, but MRI never.
MRI
Yeah,
consent.
no, need Dr. Mayada.
Need consent.
Even without contrast, they need it.
Yes,
Because
just
some
MRIs need
metals,
consent.
yeah, because there is
Yes.
questionnaire about what the patient is
Yes,
having.
this is because the questionnaire. Yes.
Yeah, any metals in his body, like tooth, artificial teeth, or even pacemaker, they are
Yeah,
asking.
you'll ask this question before, but
Yeah,
he
but
didn't
it's
need to consent on it.
no, there is. If you didn't make a consent, you might forget it, and the technician will forget it. But if you do it as a must by a paper consent form, so the technician will not allow the patient to cross this door without
And
checking this paper.
yeah.
So it's a protocol. That's why they put and provide checklist for any MRI for the same
Yeah, I think
reason. Yeah,
there is a checklist, but I'm thinking about consent because, like in the
yeah,
procedure,
yeah.
the patient need to write that the patient need to consent that I agree. But it's like checklist for the MRI, but not
Dr.
consent.
Mayada, even the checklist will be signed by the patient. Okay, they are asking the question, and the patient will sign down, or the relative. If in our Gulf, I mean the relative will sign, but sometimes the physician can fill it or can sign it after asking the patient. Okay, but there is form. You have to fill this form.
Yeah, there is form. Yeah.
Okay. This is regarding the consent and the procedure, the question related to pacemaker device. The second point, Dr. Mayada, remember also, mashallah, the pregnancy. Are you pregnant by any chance? You have to ask. And the OCP here, birth control pills. It's important to ask why, as Dr. Muhi said, for the anti-epileptic medication will interact with the OCPs. It might interact and the patient might get pregnant because of this action. So you have to ask about it. The last thing, as Dr. Mayada did, the job and driving. It's very important. Epilepsy with driving, it's a must question. You have to ask this question for any fits. And by the way, you have to inform the DVLA. Why? Because this is chronic disease. The patient will have chronic fits, either controlled or not controlled, should be reviewed by the DVLA to reassess and to update him whenever he's controlled or she is controlled. Don't forget the alcohol. If you have time, you can also, and the smoking, of course. If you have time, you can give red flags about don't be alone, don't close the or lock the door of bathroom, don't be in swimming. The same for epilepsy, red flags or safety netting. If you have time, it's better to mention them. Okay, but the most important, the MRI as a procedure, the consent, the precaution. In general, Dr. Meda, you remember the golden points in this scenario. So I guess you did it well. Any question or comment?
أنا كنت بسأل بس أنتوا pregnancy important for medications.
Not only medication, even the magnetic field for the pregnancy.
But yeah, I know the MRI is safe. يعني pregnant can do MRI.
There is question for the pregnancy.
Oh.
I'm not sure the MRI is safe for pregnancy. Maybe
I'm sure. I'm sure MRI is safe
Yes,
for
it's
pregnancy.
safe in pregnancy. MRI, no problem with pregnancy.
okay, but there is also questionnaire regarding are the patient or is the patient pregnant? So I think
Maybe
it would
because the contrast, if they will give
maybe
contrast
the
with MRI.
gadolinium, yes, maybe. Okay, thank you, Dr. Marwa. So we know now it's safe, but at least you have to address it to also give safety and to ensure the safety for the baby. Even it's safe for the patient and the baby, but we have to be sure. The same as for radiation. You are asking any patient going for exposure if she is pregnant, especially those people in the childbearing period. Okay. Any other suggestion? Thank you, Dr. Marwa. Any other suggestion, question? Dr. Mayada? Okay, you can write your scenario, Dr. Mayada, for Dr. Mahi.
Okay, we'll send in the group.
Okay. MRI with contrast. No, Dr. Sarah asked or MRI with contrast. I guess MRI without contrast can diagnose. I'm not sure is it necessary to be with contrast, but what I know, the MRI with contrast, which is gadolinium, is important for diagnosis multiple sclerosis. But in cancer or lesions, I'm not sure is it with contrast or no. Anyone has idea? He can tell us.
I've sent to the group.
Okay. So we can. I will ask Dr. Rabia about this. Is the MRI for cancer or for lesion or for mass need to be with contrast or no? Okay, your scenario, Dr. Mohi, I will read it, then I will share it. This is a 70 years old gentleman presented with a COPD exacerbation, requires non-invasive ventilation. Discussion regarding the initiation and goals of non-invasive ventilation is needed.
عشان ممكن تصحيني exactly 6 أيام
Okay.
عشان أنا أخذ big breakfast to fill my tummy up.
What you can take.
Also study in that time.
Okay, I share it in the chat box down.
Complete your study before you sleep.
Huh?
Yeah, before you sleep, just complete whatever you want to do.
Dr. Mohi, 2 minutes, then we can start. Dr. Maida, I guess you use some jargons other than tumor. For me, I mean tumor is a jargon, but you said it's
CT.
okay.
She said also CT.
Yeah, CT, so you can say
Because
scan.
the patient already, he said, I have the CT scan, so the patient knows.
Mhm.
Suppose in the exam will not see.
It's-
So
it's-
better to making
Don't
your
make things difficult yourself. As far as the patient knows about
you will take the
using
exam in
that-
UK.
Hmm? Yeah.
You will take the yes. Okay, no problem for you. I think in UK they didn't mention these jargons.
Mhm. Only on overseas centers.
Yes, overseas is very hard in jargon.
Yeah, even the urine, as I mentioned before, they
Yes.
put as a jargon.
Mm.
So you are not safe with the overseas examiner. You don't know. Some examiner, they can forget it and forgive about it, but others, they might minus you for this. To be in safe side, try to be simple, whatever the word, the jargon. Okay. Uh, yeah, the other thing, yes, when the patient is not convinced and he's asking you, why, doctor, you want to give me this, don't do that, I don't prefer, I'm afraid of. As usual, we have to give the cons and pros or pros and cons and to tell him this is in the best interest of your condition and we want to do it as the consultant decided. Plus, always there is risks. However, the benefit usually we are outweigh the risk versus the benefits. Once the benefit outweigh the risk, we are going with this procedure. In your condition, we outweigh this and we find that the benefits outweigh the risks. That's why we are going to do this procedure or this test for you in the best interest of your condition. Try to make it as a comparison. We are not doing this test unnecessary. And in other conditions, we are not doing this test. But in your condition, since you are having this seizure or this abnormal shakings, we are caring to do this to diagnose or to know what's ongoing. Okay? This is whenever and whatever the procedure is. If the patient is not convinced and he's asking why, doctor, you want to do. But the good thing you mentioned, some side effect it might happen, like allergy, exposure. But if he's not convinced, try to convince him by this way. Clear? Dr. Muhi, you ready? We can start?
Let's see.
Okay. Here you go.
Hello, good morning. I'm Dr. Ismail, Senior House Officer of duty now. I talking to Mr. Ali, and you are 70 years old.
Yes, doctor.
Welcome, Mr. Ali.
Hi, hello.
Today we will discuss some issues related to your health, and I will address your concern. Is that okay with you?
Yes.
Do you want anyone to attend this meeting with us?
No, I'm okay.
Initially, may I ask you, how much do you know about your condition?
Yes, doctor, I have this COPD for a long time. And recently I have this exacerbation of this COPD, and I become coming to the hospital frequently. That's why I'm here.
Sorry for that, Mr. Ali, and we hope we will fix this problem for you and enjoy your life. May I ask you, Mr. Ali, do you have any expectations about our meeting today?
Yes, doctor. You want to treat me about this exacerbation of COPD I had?
Yes, Mr. Ali. Today, Mr. Ali, after we assess your status and after we run some blood tests and the imaging of your lung, we found that you have a significant shortage of your lung function.
Mm-hmm.
And we wanted to start medication for you, and we wanted to connect you to a machine named as BiPAP or non-invasive ventilation. Have you ever heard about this device or this machine?
No.
I wanted to tell you about this machine. We connect you to this machine through a mask, and this mask without any leak. The benefit of this machine is to remove the
I'm sorry, doctor. I'm so sorry. Just because I feel like everything's going around me now. What do you mean by connecting me to a machine? Is what does that mean? I mean, like you're gonna let me sleep and put a tube in my lungs, or what's going on?
No. I appreciate your feeling, Mr. Ali, and I can imagine how much this news is not good for anyone. But this is not connecting to the machine by invasive or by tube to your air pipe, but this through a mask. And this mask is only covering your face and nose and mouth only, without any leaking from it. And the benefit of this machine is to remove the carbon dioxide gas from your blood, because this carbon dioxide, if it is increasing the blood, it can develop what is named as respiratory failure or failure of breathing. And the accumulation of this gas, it can be harmful to your brain. Are you following me?
Yes, I follow you, but I always have this. My respiratory doctor is always tell me that I have carbon dioxide in my blood, and this is what motivates me to leave. And I'm okay with that. Why you wanna remove it?
I appreciate Mr. Ali. You know this problem for your lung, which is named as COPD. It has shortage of the kidney of the lung for long time, and there is accumulation of carbon dioxide to a little to some extent. But in the exacerbation, what you said, episodes of severe shortage of the lung function, this carbon dioxide is rising more and more, and this can be injurious to the brain to the degree that patient become loss of his capacity or her conscious level. These exacerbations of shortage of kidney of lung can be come by only infection, bug infection to the lung, some narrowing of the air pipes. But in some severe attacks of this shortage of this lung can be accumulation rise and more, and at that time this non-invasive machine can be very helpful to remove this carbon dioxide from the blood. Are you following me?
Yes, doctor. This is it's okay. So this is machine. Is it? And you told me a mask, like the mask I'm using. I'm always use some masks when I am here in the hospital. Through my nose. Sometimes they put the mask with mouth and nose as well. Is it something like that?
No, it is not like this. This mask is a special type of mask, and it is will be adherent to your skin, surrounding all the face, and did not prevent it prevent any leak from the air to go out or go in through this mask. It is only from nose to the machine directly. There is some problem in this, that patient usually feel uncomfortable with this machine, because sometimes this machine push air by a pressure to the lung, and the patient at that time he may exhale or go exhale during the machine pushing to the air to the lung. So we usually, and also our nurse will teach the patient or that during the machine pushing air inside the lung, the patient receives this air, not exhale with this air. Okay?
A lot of things going on. So it's helped me.
Yes, it will help you, and you will feel comfortable after this. And we usually connect this machine for the patient according to the level of this carbon dioxide in the blood. Sometimes we connect it 2 hours and off 2 hours, and sometimes we connect it 2 hours and off 4 hours to make the patient more comfortable for this. It is not continuously connected to the patient. Okay?
Okay.
Mr. Ali, may I ask you some questions?
Yes.
What do you do for living?
I was working in. I was working as a bus driver, but now I am retired.
Who is supporting you at home?
My kids.
Okay, okay. Mr. Ali, may I ask you some questions? Do you smoke?
2 minutes left.
Yes. This is.
How many cigarettes for how long?
Yeah, I cut off the smoking. In fact, I was a smoke around 30. I'm now around 20.
Okay, okay. And do you drink alcohol?
No.
Are you following a program for rehabilitation of your lung?
Yes, I'm trying to be adjusted to that program, but I'm not the good one of that.
Okay. May I ask you, Mr. Ali, do you receive your vaccination annually for the influenza and for the pneumococci?
Yes.
For the bug infection? Okay, Mr. Are you compliant to your medication for this lung?
Yes, I told them.
Okay, Mr. And you are following his instructions of the nurse for how to use these inhalations for your lung?
Yes.
Okay. May I ask you, do you have any other concern, Mr. Ali?
No, but I'm afraid of this new machine you want to connect me to.
I appreciate Mr. Ali, and I can imagine how much this is not comfortable for you, but we hope we will help you by this machine. Okay?
Okay, doctor.
Okay. Do you have any other concern?
No,
Thank you. Thank you.
thank you.
Perfect, Dr. Mahim, mashallah, perfect. But
Yes,
if she said to you, I'm afraid how I can use this machine, what can you provide here?
والله هتشوفي.
Yes, exactly. How
جربي
to
وهتشوفي.
how to show her this. Show her in simple way. What you provide here.
drawing يعني لها drawing.
Okay, this is earlier to draw. But now at the end of the meeting, what you can provide here?
Can show here movie or anything in the
Okay, in the
video.
form of leaflet, brochure,
Yes,
website. Yes,
yes,
yes.
yes. I
This is
forgot it.
the only missing thing. If you did it, you will get full mark for me. Let's hear Dr. Mayada comment.
Yeah, it's very nice. But the only thing that's why you use like breaking bad news.
I'm not using a break bad news.
The performance, like I
I
have
tell you.
no news. I feel like you are breaking bad news, but this is like steps of treatment, steps of management plan. He came with exacerbation. He's not okay. I feel like it will be better if you ask the patient how you feel now, because this patient he came with the exacerbation. He must be like ill. Okay, and then what do you feel now? He will say, I'm not okay, because still he have this exacerbation. Then you will show him that as you did, you will show him that we did the blood investigation, and it showed there is accumulation of carbon dioxide. This is a toxin in the blood at the level that we need to make sure that it's above the level, because normally you have this high high carbon dioxide. Then the side effect of this NIV, the skin pressure related issues like nasal bridge, pressure sore, or ulcer. It can cause irritation to the skin from the mask. Also, it can cause bloating of the abdomen. The side effect of the NIV. And it can cause vomiting as well. Then even it can cause sinus discomfort. Some people can cause epistaxis for them. So you mentioned the bad effects. Also, it can cause eye irritation because if any leak in the mask, that's why we need to make sure that the mask is very tight, because it can cause eye irritation from the air or from the oxygen. And you tell the patient, if you feel like discomfort and you feel anxious, we can give you some medication. Like sometimes we give morphine to relax the patient and to let him sleep. And this is the what we said. Sometimes we can need to tell him about the hemodynamic effect of this procedure, but this sometimes it can cause decrease in your blood pressure because it can affect the cardiac output. So you will tell the side effect of the machine, the importance, why we need to start it, because if we didn't start it, as you said, this will lead to accumulation of the bad carbon dioxide, and this can lead even to sleep, lead you to sleep, and this is very dangerous. But at the same time, we have side effect of this machine, and this is the side effect, and weighing benefit against good effects. It's better to go for it, and you give him all the bad effect and how we will try to decrease the bad effect, like the skin pressure related issues. We try to put like moisturizing, or we will not keep it for a long time on that bridge. Sometimes the abdominal bloating, we'll make sure that we'll examine you every time, and then to make sure that the abdomen is not, there is no swallowing, or sorry, there is no vomiting or bloating of the abdomen, something like that. Otherwise, it's okay, and I think you did well. For I don't know if we are here. The most important, I think, topic for this gentleman that he's not stop smoking, and we need to discuss this with him further, because this is the mainstay of why he's here. Because the main thing in COPD patient, if they stop smoking, this is make a lot of change. But otherwise, very, very good.
I don't understand. You mean no need to talk to him about smoking?
No,
No,
no, no.
no.
It's the
It's a
important one.
must. It's a must. But I guess, Dr. Mayada, you said I cut down
Cut down
smoking.
from 30 to 20. He cut the
Ah,
smoking, but I
I
still
ex-
smoke.
I expected you say I
Yeah,
cut
me too.
at all. يعني 20
Yeah,
years for
the same
smoking.
what I thought. Yes, I
Yeah,
guess so.
from 30 to 20. So it's still.
Mm,
Yeah.
mm.
Okay. So I mean, try to focus with the words, because
Mm.
you might
Cut down.
misunderstand. Yeah. Then the decision will be wrong, of course, because she said. I mean, for me also, I heard the same, but I misunderstood it. Okay. Thank you, Dr. Mayada. Very nice scenario. It's also, I think, first time to mention non-invasive, how to give advice, how to precaution, to give precaution, instruction. I think this is the first time. Anyway, Dr. Mahi did well. Introduction, the first sentences, it was good. But I think you give her a gush of information after the introduction. That's why she told you what you are saying. Try to be piece by piece if you want to explain something. And I would like also, and I prefer to say, do you want me to explain more about your diagnosis, the COPD? She will tell you no need, doctor, because she knows everything and she doesn't need to hear about it. But I prefer to ask this question. Anyway, continue. But by the way, Dr. Muhi, in this scenario, I felt you are too much comfortable, confident, fluent. So I think it's like 100% improvement. Really, it was impressing scenario by you. Uh, but I prefer to draw whenever she's saying, Doctor, what you are saying, how would the mask look? It's look something strange for me. Yeah, appreciate that. In the same time, you can just draw a mask. Imagine this is the mask will be attached to your face. It's not as she understood. She told you, is it the same we are putting while going to the hospital? You can say, no, it's a plastic one and it's fitting to the face, checking if there is no leak, as you mentioned, from the air, and there is gush of air going to your air pipes from outside, different from the tube. The tube will reach to the throat, but this one will be outside. Yes, you can mention some precaution as before and during and after. Before, as Dr. Mayada said, to be sure that the patient is MPO, but you will not say it's MPO. We will be sure that you are not eating or you are not recently eaten something, because it might lead to feeling sick and throwing up. And it's prohibited to put this machine if you are just eat. So the best way is to be fasting at least 2 hours. Maybe don't mention hours or 2 hours. You can say couple of hours. Okay, I think this is before. During, so you will be, as Dr. Meda said, in a position, whatever the comfortable position, and the machine will be worked. You will try to tolerate, to breathe through the machine. Don't say exhale and don't make the thing complicated. Just to be simple, so you can breathe normally. Breathe normally. It's the same idea of any machine, to breathe around the pressures provided by the machine. So we will be sure that you are breathe comfortably with the machine. No need to tell her more instruction. We are doing that, by the way, in the ICU. I guess you are in ICU, right? So you explain it well. I I guess you did it well, but try to be more simple. No need to more chemistry of the machine, how it works, the exhalation, the inhalation. Just give her information that she will breathe as normally. Try to tolerate the pressures. If you feel discomfort, let us know. So this is regarding during. The aim of the machine, as you said and Dr. Med said, you mentioned carbon dioxide, but maybe some patient of COPD, by the way, they will know the CO2, carbon dioxide. But it's what the CO2? You have to mention this is a toxic gas in the blood, right? It's simply, sorry,
Yes.
yeah. I think, yeah, you missed this word, toxin. And this is the aim of any organ in our body, the liver, to remove the toxins, the lactate and so on. The conjugation medication for the kidney to remove the toxins, which are urea and creatinine and so on. What else? The yes, the lung to remove the toxin, which is CO2. So this is the aim of any organ in our body, to remove the toxin. And your, as you said, your lungs now is distracted by the smoking to the extent it cannot, or they cannot wash this toxin, or it cannot remove this toxin. So our machine aiming to remove this toxin by doing this one outside, washing this gas outside through this machine easily. Okay. Imagine you are talking to a patient. By the way, you can do it in your unit. You are doing it, I think, in daily basis, or maybe more than this or less frequent than this, but it's in the same way. But because of the stress of exam, you feel like there is a gap between you and the surrogate. But if you do it as in real life, you will do it in perfect way. I think this is during and before and after. After, we will be sure that your blood gas is okay. We will do some tests from your blood to be sure that the carbon dioxide or the toxins are not raising up. And by this way, we'll be sure that your brain will be okay, you will be awake, and it will not harm you. This is after. And after that, you can tell him about taking food or whatever. Let's go to the golden question you ask. I like this question. It's like you give him instruction, but I prefer not to ask. So you will tell him, as every patient with COPD, we give this instruction regarding the vaccination, the technique of inhalers, and the smoking. In smoking, you can ask as a question, but I prefer not to take history by asking about the vaccine, how you are compliant to the medication, or what are the technique you are using. Give them as instruction. So we are instructing our patient regarding the technique of the inhaler and the medication compliance and the vaccination. Every patient with COPD, we are giving this instruction. So don't ask, just enumerate this instruction. He will remember and he might tell you, yes, doctor, I am following, I am doing, I am in contact with my GP, I'm taking these vaccines on time. But don't ask him as a question, okay? It will consider as a
More,
history taking.
more polite, yeah. So
Yes, with the polite way, yes. You
more
can,
polite.
sorry?
It will be more polite way
Yes,
instruction as a
yeah, an
like
instruction. But why I'm saying that? Because it's not allowed to take history apart from social and
mm,
smoking and alcohol. The other things, if you ask him, are you compliant to the medication? This is history, right?
yes, yes,
History
yes.
taking. We are not allowed to take history. So the best
Mm,
way is to give him as an advice or instruction. Please be compliant to your medication. Please be compliant to your vaccination. Please be adherent to your inhaler. We will give you some brochures, leaflet about the technique of the inhalers. I didn't ask him any question, but I am just advising, and he will might tell me, or he might tell me if it is wrong technique, or I have doubt about the technique, please refer me to. So it comes as a question from him, not from me. This is the way how to address other things related to the COPD. By the way, it's perfect to mention them. Okay. The last thing, the job, and you can provide some help. Do you need some help? And the program is very nice to mention. Do you follow any program regarding your disease? Because also they need some rehabilitation, some respiratory therapist. Okay,
تمام.
perfect. But in general, it's much better than previous.
ربنا ييسر إن شاء الله.
Okay, be the same confidence, the same fluency. Believe me, you can do it. Hope inshallah.
إن شاء الله.
Okay, thank you, Dr. Mahi. Any other question, Dr. Mayada, or added point, suggestion?
No, very good.
Yeah. The most important, again, at the end of any scenario, you are explaining something, you are giving instruction about something. At the last second, I will provide you leaflet, brochure, website about, for example, in this scenario, the non-invasive ventilator machine. In previous scenario, the MRI and the instruction about the MRI. The red flag and the safety netting, it's very important in any scenario. Okay. The leaflet also, it's important as well. Okay, thank you, Dr. Maida and Dr. Mahi. Any question from others? Yes, Dr. Sarah asked, how can I explain COPD? Perfect question. The machine need consent? Also, no. The treatment doesn't be consented. Doesn't need to be consented. Okay? It's one of the management plan, so no need to get a consent. The patient already signed a general consent form in the emergency that he's agreed to receive the all management plan. Sometimes they specify certain specific consents, maybe like chemotherapy, like monoclonal, biological, but it's not the topic here. So the non-invasive is one of the management plan the patient consented earlier in advanced in the emergency before be admitted to the ward. The second question, how can I explain the COPD? You can explain it from the abbreviation, chronic obstructive pulmonary disease. So chronic, it's a long-term or long-standing disease confined to the air pipes, making or causing narrowing of the air pipes, obstruction, narrowing. I didn't add any decoration to the same, what I mentioned in the same abbreviation, but in the simple way. So chronic, long-standing, obstructive narrowing of the pulmonary. Pulmonary means the airway or the air pipes. So disease, it's disease. Chronic, long-standing, narrowing of your air pipes leading to the symptoms you have. Very simple. If you want to add, it might be related. So the pathology, now I'm talking about the COPD at the COPD definition. If this is a case of counsel about COPD, I should give a pathology, why this patient is having COPD. So I tell her or him, it might be related to certain causes. One of them, and the most common worldwide, is smoking. You can give some causes which is common, particularly if written in the scenario. But if not written, you can give him. If he asks you, what else, doctor? You can say occupational, related to certain toxin, occupation, maybe related to the job, related to genetic, like alpha-1 antitrypsin. This is regarding the pathology. But again, it's according to the scenario. No time here to explain all these things. But if the scenario counsel about COPD, you have to mention the definition, the manifestation, which would be cough, expectoration, which is the phlegm, chronic infection comes and goes, and sometimes you have short of breath, severe short of breath, to the extent you might be admitted to the ICU or critical unit. This is the manifestation. The pathology, as I mentioned, the causes, the smoking, the occupational, and the last is alpha-1 antitrypsin as a genetic condition. You can mention the name of disease, then explain it. So one of the condition which is confined to the airways again, or the some tissues in the lungs, which lead to the same disease. Complication, as Dr. Mahi said, severely short of breath, maybe it's called or might lead to what's called breathing failure. And you might need to be connected to a machine either through a tube or through a mask. Simply how to counsel about COPD, what I mentioned earlier. Of course, the management plan will be in brief what I should do. The patient, I mean, stop smoking, counsel about the condition, exposure to, for example, chemicals or something may be toxic, and the pharmacological option, you can give a bronchodilator, which is inhalers, and so on. Vaccination also will be one of the counseling points. Okay, thank you, Dr. Sar. I guess it's a very important topic. Maybe we have session. Yeah, we have session about COPD. If you want to listen to it, I can provide you can just remind me in the group. We have a lot of COPD counseling in the sessions, previous sessions. Any other question, comment regarding both scenarios? Any scenarios? Any communication? Any doubt? Dr.
Salam
Aisha.
alaikum.
Alaikum salam, Dr. Aisha. Yes, go ahead.
Yes, can add at some point regarding the first
Sure.
scenario.
Yes.
The first of all بالنسبة للMRI بالكونتراست بالبرين تيومر is preferable عشان يكون
Perfect.
الإيمجينج تكون أحسن لما تكون فيها كونتراست.
Exactly.
بالنسبة للبريجننسي البريجننسي السيف الإيمجينج أول حاجة الألتراساوند. السكند الMRI لو كانت after الفيرست ترايمستر تقعد سيف الMRI without contrast. الMRI with contrast الفكرة في الجادولينيوم cross into the placenta we affected the child. I think regarding the scenario the benefit and the risk if يعني even if the scenario يعني needed into MRI with the contrast for مثلا for diagnosis يعني you can but with يعني with caution.
Perfect.
Okay. الother imaging الX-ray chest
Yes.
X-ray save low risk.
Yeah.
الموست dangerous بالنسبة للبريجننسي الCT
It
abdomen
with
والCT
contrast.
pelvis. الCT
Yeah.
abdomen والCT pelvis should be avoid والCT chest والCT head most حتى هي be careful إلا special في الemergency situation.
Yes. They can use the abdominal sheet.
abdominal sheet في الشست X-ray but ال CT abdomen and pelvis high risk of radiation فهي avoided.
No, CTPA, CT pulmonary angio, they are using shield.
Yes, CTPA yes can be. But I
Yes.
think the pregnancy used the ventilation perfusion scan في الBE.
They can use this or the CTPA with using abdominal shield to cover the baby. This is another option. But VQ mismatch can be used also.
Yes.
You're right.
Okay.
Yes. Thank you, Dr. Asha. Very precious comment. It's complementary about what we mentioned earlier, and I said I will update, but you updated us. Thank you. So the contrast to gadolinium is the most, avoidable, or it's something to be taken with precaution. Apart from this, ultrasound is the most safe during pregnancy, then MRI without contrast, then the CT or the MRI with contrast. Thank you again, Dr. Rasha. Any other comment? Any added suggestion, explanation? Dr. Aisha, I asked you earlier, you want to add anything?
No, very good explanation from Dr. Muhi really, and I think he cover most of things. Just the
Mhm.
complication of non-invasive. I suspect from the scenario it's CPAP, but I don't focus that he is in hospital and now he is in urgent situation. So
Yeah,
it's first time, yes. I suspect I'll discuss the CPAP at home, but I think it's the same and the same complication also like that. Yes.
yeah, the same. But usually it's not CPAP, it's BiPAP. So bi-level. It's different from the CPAP for pulmonary edema, for obstructive sleep apnea, also, but the BiPAP for the COPD because of CO2. So we need a backup rate and backup pressure or bi-level pressure. It will help us to wash the CO2. This is the difference between BiPAP and CPAP. Simply CPAP for obstructive sleep apnea and pulmonary edema.
And the BiPAP for
BiPAP
COPD.
for COPD or any respiratory failure need to be
But they are both
adjusted rate.
non-invasive ventilation called
Yes, both of them. Yes, exactly. So
yes. And
non-invasive
this scenario it is BiPAP.
exactly because CO2 is high.
So pressure in inhalation and exhalation both, yes?
Perfect. Yes, exactly.
Yes, okay.
But CPAP is continuous pressure, and the patient
And
will
this is
breathe.
not used at home or also
Yeah. Can be. There is
can
BiPAP
be?
at home. There is CPAP at home. There is
Yes, okay.
different mode.
Yes. Yes, I first time to hear about complications, so we should take
Perfect.
care about source ulcers and some
Yeah.
vomiting and this is
Yes.
irritation in the nose.
Perfect.
So
Yeah,
thank
and
you
also
all, yes.
and ulceration of the eyes. Yes. Thank you as well, Dr. Aisha. Thank you for your comment. Any other question, comment, doubt, suggestion? Dr. Aisha, I need your positive feedback about Dr. Muhi.
Yeah, he done perfect, mashallah.
Yeah,
About
okay.
remembering vaccination, but just
Yeah.
to big advice, yes. But he is confident, yes, this time, and he is making the scenario very good.
Yes.
Yes.
Perfect. Thank you.
توفيق دكتور محي إن شاء الله.
Yeah. Keep it up, Dr. Muhi. Same confidence. And hopefully, again, tomorrow, we'll let you practice till the exam. Inshallah, to pass this exam. And anyone else has exam soon, it's our pleasure to welcome him. He can practice or she can practice. Okay. Dr. Mayada, mashallah, already perfect in communication. But
yeah, every time practice is important.
yes.
When is your exam, Dr. Mahi?
After 2 weeks.
Don't remind him.
It will be okay.
Yeah. Hopefully, inshallah. Just gain more confidence, practice till the exam, and hopefully you can
بالتوفيق
do
إن
it.
شاء الله. بالتوفيق
Inshallah.
والنجاح إن شاء الله.
Don't like Dr. Mayeda.
Yeah, Dr. Rasha also prayed for you, mashallah.
Yeah.
You will gain more prayers now from us.
Yeah.
Inshallah. Okay. Any question before ending the session? Any suggestion? Tomorrow, Dr. Muhi and Dr. Ahmed Abdel Akhir, he prepare a scenario for you. So be ready for long clinical tomorrow, Dr. Ahmed and Dr. Muhi, inshallah. We can end this session now. Thank you everyone for attending and listening, sharing, commenting. Special thank Dr. Muhi as well, Dr. Mayada, and everyone attended and helped us today for the comments. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
السلام عليكم السلام